This is going to be a quick how-to guide on how to set up your patient on high flow at our clinic. So in the back of soft tissue OR, we have a couple bins. Top bin are going to be all the different nasal cannula and sizes. And so remember, it's going to be very important to select nasal cannula specific to your patient. Remember, you're going to want the overall cannula to nasal diameter. You want less than 50% of the nose occluded by your nasal cannula, and that's incredibly important to prevent the risk of major and or life threatening side effects. So that's kind of the top bin. The next two bins are the high flow and low flow circuits. There should be a high flow circuit already on the machine at all times. But each one only lasts 30 days. So if you don't have one set up, you can basically just pull one out depending on which flow you need. And then at the bottom are sterile water bags with additional sterile water bags over here. In order to get things started, you're first going to have to either have a system already set up or you're going to have to choose one. So when you initially open up your high flow bag, there's going to be two major things in here. One is the cartridge, and the second is basically the connector that is going to go from the cartridge in the machine to the patient. So I have one already unpackaged, and so essentially you are going to kind of look here and see there's really only one place for an attachment. So you are going to take your line and you are going to attach it, and it kind of clicks in place. Up here is going to be clamped, and then the blue end is going to go towards the patient. So just to kind of show, we're going to take our nasal cannula for our patient and kind of hook it up. And so again, this will give you a good idea of what things will look like when it's on the patient. So you are then going to take your cartridge, and I'll just turn this. There is this little side door on the high flow system. You're going to open that up, and you're kind of just going to slide this in there. There's really only one way for it to go. This area back here is the heating element, and then there's a couple sensors. And so this is just going to slide in nicely. You shouldn't have to put any significant pressure. And then you can kind of close it. So once that is closed, the next step is to attach your sterile water up here. So we're going to take an alcohol wipe, and we're going to kind of clean off the spike. We're going to attach our sterile water, and then that'll hang up here. All right, and then you can, when you're ready, unclamp this. So now that the system is, the circuit's all attached, next step is that you are going to start kind of getting things plugged in. The machine itself does not start until it is plugged in, but we're first going to start by plugging in the compressor. And the air compressor is what draws in room air. You want to make sure that your humidity water bottle is empty. If it's full, you're going to empty it before use. Next is you're going to plug in your oxygen to your hospital line. And so now you have your circuit set up, air set up, oxygen set up. And so lastly, and the way that this machine is going to turn on, because there is no power button, is you're going to plug this in. You'll see that once we plug it in, this is going to start up. And so there are really only three buttons here. One is a silence, one is the run standby, and then this center blue knob is how you will basically select anything. So as you see, it's starting a bunch of blinking. If you click it in, it starts blinking one. You click it again, you're going to increase to 37 degrees centigrade for almost all patients. And then you can start to prepare for your patient's liters per minute if you wanted to, or your oxygen. However, it does need to heat up in order to get to that. So you're going to basically give it time. And once you have enough time, then you're going to go ahead and click your flow no flow button. And depending on the, if it's been enough time, you'll either be at temperature or not. So you see here that now that it's blinking green, you have to make sure that that is open. So you'll see water flowing through, and that's all normal. And then as long as everything's going in the right direction, then you'll be able to kind of continue on. This is of course giving an error because we have the good luck of making a video. But that error means that there's an issue with the oxygen line, and so we'll get that all figured out. However, this green light is going to continue blinking, and then once it is ready, then you can push that to start. So if you have any questions, feel free to give me a call, and good luck.